So to me, I was feeling pregnancy was pregnancy until our professor in the class hit us up that in pregnancy you have biochemical pregnancy, we have clinical pregnancy. So you're saying biochemical pregnancy is more of like you are testing, all right, the samples of a woman, and estrogen, progesterone are shooting up. Do you understand? But he was not saying that thing that I don't actually confirm pregnancy 100%. Do you understand? Because some other issues could also make these things shoot up. Yeah, so I was shocked. I was just feeling, oh, pregnancy is just pregnancy. Do you understand? Till he now drew our attention to that vital point, right? Because there are so many tumors, there are so many issues in the body that could make progesterone, estrogen shoot up. Do you understand? So a clinical pregnancy is indeed the real pregnancy. So there are so many ways that you could actually do to kind of like confirm it. You understand? So let's talk about these modalities. So to confirm a clinical pregnancy, providers rely on what? Both biochemical testing. So if you do only biochemical testing, that's a biochemical pregnancy. All right. Clinical pregnancy focuses more on imaging techniques. So I'm doing an ultrasound. I'm looking at this baby. I'm looking at the heartbeat. I'm looking at fetal movement. I'm looking at the baby kicking. Real time. This is what confirms pregnancy. Not only, test here and there. Many other things could make those hormones shoot up or go down. So biochemical confirmation, you do a test for human chorionic gonadotropin. All right. So two types. You have the qualitative. You are trying to confirming the presence of the hormone. Then quantitative. You are trying to know how much of this human chorionic gonadotropin was made. Okay. Then you also do physical examination where you pick up the Chadwick sign, the Hager sign. Then you also examine the breast of the woman to make sure that it's kind of like changing up, becoming tender and all of that. All right. So the next step is what? Ultrasound imaging, where you can use transvaginal ultrasound. This one is abdominal. All right, abdominal ultrasound. The transvaginal is kind of like a stick. Yeah, you put it right into the vagina, to the cervix, all of that. So clinical and chemical pregnancy. So a chemical pregnancy is confirmed only by human chorionic gonadotropin, but clinical pregnancy, we are confirming that the embryo is there. All right, indicating that implantation was successful and that the development of the baby is ongoing. Okay.